I'm Bunny Ellerin. I'm the co-founder and CEO of New York City Health Business Leaders, and wanted to welcome you to today's webinar, The Next Generation of Women's Health. I can say for sure we have never, ever had this much interest in a program that we've done, either online or offline. So that's very exciting. Our moderator is Stephanie Davis, who I've gotten to know over the past few months while working on the Healthcare Innovation Report and the Women's Health section. Stephanie is both an analyst and managing director at SVB. She's an expert in healthcare technology and distribution. She's been in the industry for over a decade. She was just telling us meaningful use was like the big thing before when she came to the industry. And I can say for sure we could not be luckier to have a moderator like her.
Bunny, thank you so much for the kind introduction. And thank you for letting SVB be a part of this women's health panel. It's an incredibly important topic to both myself and the broader company. And so we appreciate the opportunity. Kicking things off, I would love to hear a much better explanation of how you folks got here and more about your path. So kind of what drove you to focus on your specific end market within women's health, and what made you choose women's health in general when that's often been a very overlooked part of healthcare. Ashley, do you want to kick it off?
Sure. Thank you, Stephanie. Great to be on this panel with everyone, with these impressive founders of amazing women's health companies. To share what drove me to focus on women's health, and specifically women of color's health, was my personal experience navigating healthcare and working within the healthcare system as a Black woman. It really opened my eyes to the systemic issues that play a huge role in the disparate health outcomes that we see. And then during my time as a public health student, I became acutely aware of the disparities in health outcomes for Black women and other women of color, and didn't really see too many solutions in the market that were addressing the very specific needs that we have. And so that ultimately spurred me to build a solution that's tailored to addressing the specific needs of women who have been severely underserved and marginalized by the traditional healthcare system.
Thank you. I'm so glad to have you joining and offering that perspective. Janine, you're also serving another overlooked part of women's health, even though it's 1/3 of women's lives. Can you share us more about your path?
Sure. And likewise, thank you for having me. I really look up to and admire my fellow panelists. So this is lots of fun. Basically, I co-founded Electra along with my amazing co-founder, Alessandra Henderson, and our founding physician, who's a menopause specialist, board certified in OBGYN and integrative medicine, recognizing that there's a massive gap in women's health when we think about women beyond their reproductive years in particular. And because menopause lasts for, as you said, 1/3 to half of a woman's life, it's, is universal, a normal, natural, biological experience, and yet one that has been mired in so much stigma that we don't talk about it. Physicians are undereducated in it. We could talk about a whole host of reasons why this has been such an underserved area, but for that reason, it was an incredibly compelling opportunity. And I've been in digital health for a long time. Over 10 years ago, was pitching mental health startup ideas to Boston-based VCs when I was in business school, and hearing, oh, this is a really important problem, but I just don't think that there's a solution here, or not a business model. And so I think it's important to bear in mind some of that history as we think about the evolution of women's health, which, happily and hopefully is really changing in large part due to forums and champions like the folks on this call.
I love that point. Carolyn, can you continue on that discussion?
Sure. Hi, everyone. I'm Carolyn Whitty. I'm really excited to be here and share a bit more about TIA and the overarching problems and opportunities in women's health alongside these amazing other founders I'm lucky to work alongside in the space. A little bit about the TIA story and the problem we aim to solve. We very much, pride ourselves on being the anti-point solution, designed really to reimagine what healthcare would look like, work like, feel like if designed with women at the center, shifting from what I describe as a one-size-fits-most healthcare system to a new healthcare system that's personalized and people-based. And we're building the care model for women. That's really what we aim to do. The second piece of that is really about shifting healthcare from treating body parts or designed for CPT codes, as I often say, to treating women as whole people. And TIA really as the widest point of entry in women's health, we provide comprehensive physical, reproductive, and mental health care for women puberty through menopause, or what we describe as whole women, whole life care. So excited to share more about women's healthcare with you all today.
And finally, Adrian, you saw a very deep need in the maternity center that wasn't being met. And you were even shocked with the kind of reaction you had from folks. So tell us more about that.
Well, I mean, to take a step back of how I even got into women's health in the first place, I think it's just always been an area of passion for me. Like back to when I was in high school, like going to the Women's March in DC, like it's an area that I've been just excited about. I think it comes from honestly growing up with three brothers and feeling like I watch how like they operate through the world and feel like if they were ever pregnant or if they ever had to go through what it is to like have a uterus, that healthcare would look dramatically different. And so I think I've always come with to like the lens of women's health with almost like a little bit like of indignancy that this is like the experience that we have to go through. And I started off focusing a ton on sexual and reproductive health. When I was in my 20s, I got a master's in public health in that area. And it probably wasn't until my 30s that I started paying attention to maternity care and realized that in some ways it had all of like the same problems, which like we don't center women in their experiences. Like we don't design care based on what they want and need. And unlike, sexual and reproductive health, which is sometimes so politicized in this country, it felt like, everyone can get on board with babies, and we're excited to, build a business in a space that I think it just is a huge opportunity to change how women go through it, but also like how families experience it, right? In some ways we're creating like the next generation of parents through maternity care. And so there was just a huge need to have a more holistic approach to it.
I agree on all of these fronts. I mean, when you're looking across the different answers from my panelists, all of you guys have mentioned that there was kind of an overlooked aspect to what you guys were doing. And I think it's very interesting because when Bunny and I were looking at the topics that we could have for this 2022 New York Healthcare Innovation Report, women's health actually rose to the top as something that folks have been asking about way more during the pandemic. I'd be curious how you guys have seen this market uptick in interest manifest in your day-to-day, especially in the fundraising side, and maybe your thoughts on what drove this change. Carolyn, could you kick us off?
Sure. So I've been building TIA for the last 5 years, and it's been quite a journey to observe and really partake in the mental model shift amongst investors, but also traditional buyers of healthcare, payers, providers, employers, and so forth. When I started TIA, it was very much women's health is niche. Why would you build a product that cuts out 50% of the population? And I think last year when TIA, we were proud to raise a $100 million Series B financing that I think is indicative of women's health finally being on the map in certain regards. I think it was really a byproduct of this mental model shift to the world waking up in many ways to a long known truth that women are the most powerful yet underserved customer in healthcare who control more than 80% of the dollars. And so rather than thinking about cutting out a TAM, it's really about how personalization can drive more value, both for women as the power brokers of healthcare who use and spend more on their own care than men, but also make the bulk of the decisions on behalf of children, partners, and parents. And it's exciting to see this shift in the fundraising environment as a result. I will caveat though that we have a long way to go. And I'm really excited to be here with so many other amazing female founders in the space. And I think oftentimes there is, I think now this desire to look for a singular women's healthcare bet, like you can make only one bet in an industry that represents more than $3 trillion in spend every single year. And so I hope today that collectively we can help break that misnomer in certain regards and drive more spend investment in the category that is really just, I think, being represented on the map and in the very early innings, and excited to collectively start to move the needle on the actual outcomes to facing women as well.
There's a comment in the chat about how women's health is often viewed as a niche, or God knows when I brought up with investors, folks will say, well, that's such a small TAM. Why even bring that up as something that important? That's a fantastic fact to highlight, Carolyn. 80% of all healthcare spend goes through women. Now, Ashley, you've also been and was often an overlooked part of healthcare, partially because of design, partially because of lack of investor engagement, which I think is a huge gap in how the community is putting this together. Can you talk to us a little bit more about how you're seeing rising interest in your space and maybe what folks could do?
Yeah, I mean, I've definitely, I would say in my day-to-day, I've seen more inbounds from investors that have expressed that they're interested in women's health and our particular focus on women of color's health. So that's been exciting to see. And I hope that persists as we look ahead to raising our seed round. But I'll caveat or preface what I'm about to say with the caveat that we do need more women investors. But I do think the uptick in investment in women's health is in large part because there are now, as I said, like we need many more, but there are more women who are making these investment decisions. And so I think that that's also playing a role in why we're seeing a lot of investment in or growing investment in this space. And we definitely need more, especially for solutions that are addressing the needs of marginalized patient populations. And then to add on to what Carolyn said, I do think that we're finally at a moment where we're embracing a much broader view of what women's health is, that it's not just focused on fertility or reproductive health, that women have organs, other organs that need to be taken care of. And so there's definitely a heightened awareness of that, and then also the business opportunity as a result.
I agree on that. I could not agree more. And I'm glad that folks are starting to look at this. Janine, you've got that niche part of the women's health niche, which I think folks often forget is such a large part of a woman's life. Have you been able to convey that properly to investors? Have they been picking up that message?
I think investors are a broad category, and I'm sure everyone here who's talked to pitched investors has had to do a fair share of education. And so, if you have a 30-minute intro conversation, how much of that time are you spending on, well, this is the lifespan of a woman, and this is where menopause, sets in. And I think that oftentimes what Carolyn said is really true about this. I have a part of my portfolio, probably just one investment at any given time set aside for women's health. And it's like, oh, check, got that. And now I'm going to think of the rest of the portfolio as, broadly health. But oftentimes, that that idea of the niche is perpetuated by the approach to the portfolio, which can be unfortunate. But we have seen things changing, and I think that is exciting. And it takes time to be able to broaden people's views, but both consumers and payers are starting to, I think, look beyond pretty narrow definitions of how we've thought of women's health, which is promising and gives me a lot of hope.
That's a great point. That's a perfect segue over to Adrian, because Adrian, you just did a partnership with Mount Sinai West, correct?
Correct. Yeah, I think it's interesting to see when, kind of like the old guard feels like there's value in connecting and associating themselves with newer brands. Even like 5 years ago, I don't think they necessarily appreciated it. And I think there's maybe growing recognition that they can't or weren't kind of built with the DNA to really adjust and address the current needs of the consumer. And more are looking for folks to partner with to bring that capability to bear. I think it's been really interesting to see. And I think also why you see so many companies starting in this D2C focus, right? Where they realize like what's so important to be able to demonstrate to the market is that you can engage the consumer, and that's like the most important thing, because it's a thing that the payers and the providers and the employers of the world really can't do well. And you can have the best care model in the world, and you can have all of these things that you're trying to do better, but if at the end of the day, the consumer doesn't, vote with their feet that you're what they care about, it doesn't matter. And so it's been really interesting to see folks like Sinai look for partners that are able to bring that, consumer lens to bear.
That's an interesting point to bring up, because when I was putting together kind of the care continuum for women and all the different companies and where they fall in there, I was kind of, I'm not going to say just surprised, I was shocked that almost every single company I spoke with was D2C, right? No one had found some way to partner with the traditional healthcare system. How do you think we can get these established payers to actually pay attention to everything that's happening? Ashley?
Yeah, I think, because women have been so severely underserved by the traditional healthcare system that, as a founder, someone's building a company or women's health solution, it only makes sense to try to just directly engage that woman as opposed to having to go through the payers. And I know for me, I knew I was going to have to prove that I could actually engage the patient population that I was seeking to serve first before I could even make a business case to a payer. And so I think that that's, I'm seeing a lot of head nodding. I think that that's a lot of our thinking, that if we are able to go directly to the consumer themselves and engage them, we can then make a case to the payers that, look, you really should be paying attention to this solution because the consumers are engaging with it and they want it and it's actually solving a problem.
Now, flip side of that, Carolyn, Tia accepts a lot of insurance.
We do. I think for us, when we kind of set out to start delivering services to women virtually in person, the idea was, how do we deliver a care model that meets women where they're at and actually owns that relationship and cultivates trust in a way, frankly, that traditional incumbents, the payer, the health system, does not have that relationship, or increasingly has eroded that trust. So we found value in that direct-to-consumer model, but also seek to create a product that works within the confines of the traditional system that dictates cost and access. And that meant figuring out how to work with payers, with health plans, to be able to accept insurance for all of our services, from primary care to gynecology to mental health to acupuncture, pelvic floor, physical therapy, and the full suite, which has been no small feat. And so what we really pride ourselves on is being a model that is direct to consumer, but helps women put their insurance to work for services that, particularly preventative healthcare services, and ones that oftentimes can be difficult to navigate. The second piece of that, though, is what I would call really taking that relationship that we have, the B2C that's been enabled through the direct-to-consumer piece, and then using that to actually drive value with other players in a B2B model. So I call this a B2C to B play, which is really what Tia is doing now. And I think what Ashley is speaking to, the most powerful way to go to a health system or a health plan and get them to listen is to say, I have a bunch of women who love and use my product that you don't have. And I often say, more than 50% of women in the United States don't trust the healthcare system. And said another way, the healthcare system has a loyalty crisis with their most powerful customer. And so I think bringing it back to what Ashley is saying, if we can individually and collectively, as founders of healthcare companies servicing women, demonstrate that women want our products in a direct-to-consumer model, then go to these other players to enable access, I think that's a really powerful way to build a sustainable business that is all about relationships with this highly valued customer.
Agreed on that. We had some questions from the audience ahead of when the webinar started, and what I thought was really interesting. There were a lot of questions about the barriers in advancing these women's health initiatives, right? Why is everyone D2C? What is keeping folks from being more aware? Janine, do you want to try and take a stab at that? No, that's a very big question to answer.
I think payers move slowly, first of all, and their goal is to manage costs. And so prior to Electra, I was on the founding team of an organization called City Block Health, and we provide value-based care for those who have complex medical needs as well as social needs. And the entire premise of that business was around increasing the quality of outcomes and care delivery to be able to reduce costs and therefore make a more sustainable healthcare system. And those are patients that cost, a given insurer $30,000 a year. And that is really, the number that folks are looking at, whether they're self-insured employers or they're commercial payers or Medicare, Medicaid, they're really looking at cost reduction. They've been doing that for a long time. So shifting their perspective to look more holistically outside of, just CPT codes or procedures that put people in the hospital and cost a lot of money, including high-risk pregnancies. It takes a while, and it takes, I think, a sustained effort from stakeholders, including consumers. But with, you know, the press that has been generated around women in the workforce and the challenges of, especially in our demographic at Electra, we pay attention to those in their 40s and 50s and 60s. People can experience menopause earlier and later, but it tends to be in that demographic, which is really coinciding with the apex of careers and families and often aging parents. And so I think we're starting to see demands at a societal level that require payers to shift their thinking away from simply managing costs. But, you know, if you look at where spend goes in women's health, it's often to gynecological surgery, gynecological, you know, procedures. And also that's where physicians make most of their money. So we have to sort of look to where the money flows to understand why the trends have pointed in this direction for so long.
From a money flows perspective, I also thought it was striking that many of your guys' solutions weren't necessarily disruptors of the healthcare system, right? It's more a redesign, or to make sure that the user experience is different and better and more tailored to the folks that are actually consuming the services. Adrian, you talked to me before about the shocking level of demand that you saw when you first opened your ULA center. Can you tell me a little bit more about this and why you think this was the case when there are so many maternity centers that are likely available in New York City?
Yeah, it goes a little bit to, I think, what I said before about like why Sinai would even partner in the first place, which is a lot of these institutions like may have like the same things in theory that they offer, right? It's sort of like, you know, you're cooking, like they have the same ingredients, but like the recipe comes out really different. And so while they may have OBs that offer appointments or OBs that like do telehealth services, they didn't design and build their infrastructure from like the very beginning with the consumer in mind. And it's a really hard thing to reverse engineer and layer on top of something when you've built entirely for a construct that was fee for service, and the person who was paying for the care was the payer and not the individual. And so you just have these systems that like, it's really hard to sit there and rehire your entire team, rebuild your tech, redo everything in order to create that consumer-driven mindset. And so, I mean, we had the advantage of being able to build with that mentality from the very beginning. Like a simple example I think of like is for prenatal care. So women, you know, find out they're pregnant, maybe they pee on the stick, it's week like 4 and week 5, and they're really like excited. And they call up their provider's office to be seen. And they're like, cool, we'll see you in 4 weeks, 5 weeks, 6 weeks. And the woman's like, but I have questions now. Why can't I see someone now? And from the systems perspective, it's like, well, there's nothing clinically we need to do right now. So we'll see you in 4 to 6 weeks. But for the woman, like there's a ton that she wants at that moment in time. And so just being able to make tweaks all along the journey and the pathway creates for a really different experience for women, even if, you know, on the surface you could get prenatal care and, you know, someone to catch your baby with a different provider.
I love that term, catch the baby. That's it. Whenever I talk to my girlfriends, I've gone through kind of the traditional system for maternal care. So much as that, it's just, you know, the doctor is here to make sure the baby gets from point A to point B. Everything else is kind of on me. I'll QB that on my own. Now, I think about the issue of a non-women centric design. I think about the experience that my stepmom had actually when she went to the traditional health system. And I think she was often overlooked for being a woman of color because she was, you know, that there was just this perception that she didn't know what she was talking about when she was talking about her own experience in healthcare, which was mind blowing. How have you found the way to solve for that?
Such a very intense question there, Stephanie, but that's what we're completely focused.
But it was shocking, you know, it was like the experience she had versus the experience my dad had. And maybe it was more personal because, you know, they were from my family, but seeing that I was always shocked. I was like, how is his view more valid than hers?
Right. And that's a resounding thing that we've heard from women who use health in her field where, you know, they've had a negative experience with a provider where they were dismissed or they weren't taken seriously. You know, my co-founder said that when she was giving birth, that she asked to see, like, know her vitals, and the providers kind of dismissed and thought that she wouldn't understand the data, and has a whole MBA, but just by virtue of her being a woman of color, like that was, you know, this assumption was made about her. And so what we're, you know, what we're trying to do to facilitate trust is one, just naming to Black women and making know that women of color, that the healthcare system has been problematic. There's structural and systemic racism, and just really naming that and calling out and validating why there is so much mistrust that women of color have with the system. And then from there, building a solution to essentially be the conduit through which women can find trusted providers who are willing to hear them, to see their humanity, to take their lived experiences in the context of their care, because that's another component that's really missing, that women of color, as they're navigating life, they're dealing with specific life experiences or encounters that ultimately impact their health. And so if their clinician isn't taking that into account, there's a whole world of information that they're not getting about their patient that could really support them in providing more sensitive and tailored care. And so we're doing that by, again, being the conduit to helping women of color find trusted providers that they're more likely to engage with because they have that trust with that provider. And then we center their lived experiences in the health content and information that we provide, because that's been another issue, that women go to clinics or they seek out health information and they don't see themselves reflected in that. And because of that, there's stigma, or they feel isolated in their experiences, which again, just makes that experience a really terrible one and makes people not want to engage with care when they really need it. And so those are some of the ways that we're trying to solve for this problem. But I would caveat that and say a digital health solution isn't going to solve the issue of systemic bias and racism in the healthcare system. But what we do want to do is make the experience of navigating care more easy and less anxiety-inducing for women of color.
On the care navigation topic, Carolyn, you told me when you guys started, you was almost more, and I hate to use that term because it's such a buzzword right now in healthcare, but you started your life at TIA as more of a care navigator because so many folks were dismissed or didn't really know how to go through the system. Can you tell me more about that?
Sure. I think it really, TIA's origin story in many ways speaks to the complexities women face in navigating both health information and huge amounts of misinformation online, as well as navigating the care experience as well. So for those of you that don't know how TIA started, we were a digital front door Q&A app. You can think of us like a texting service version of WebMD for women's health. That was all about giving women personalized science-backed answers to their health that translated hard science for the laywoman. And as Stephanie mentioned, what we found very quickly through this experiment, we had over 200,000 one-on-one conversations with women about their health, that questions like, hey, Tia, I missed my birth control pill, quickly led to, hey, Tia, what of a deductible? Can you explain my copay? Or can you translate my test results? And quickly we found ourselves doing things that I didn't know were, billion-dollar businesses, coordinating their care, helping women navigate insurance and benefit design, translating test results, giving them referral points, these sorts of things. And that's really what led us to our core thesis around the power of information and care coming together. And flash forward to what we are today, and actually in the services space, I think the basis of what we really think the future of healthcare, not just for women, but for everyone, is about coordinated care, about care continuums that move beyond singular billable visits to care journeys that are omnichannel, whether care is delivered through chat, video, a clinic, a hospital, at home, all those different places of care, but also things that happen outside of, I think, the way healthcare systems often describe these things as visits or episodes. And healthcare, I think, is the big and small decisions we all make each and every day. It's access, it's to healthy food, it's childcare, it's transportation, it's the information. And I think platforms that can help women make these decisions for themselves, backed by science in a coordinated, easy to navigate way, and can cultivate trust in a more powerful way and help improve those outcomes for women and families too.
Kind of continuing on that view of trust and have the need for information, Janine, I think about the deferential approach that the traditional health system often takes to menopause. What was your aha moment where you realized that there was such a gap and need for this and that you'd be able to fill it?
Yeah, absolutely. I would add on a personal note. Part of my reason for joining the space was, I mentioned I worked in different aspects of digital health previously, had seen women's health companies coming to the fore, leveraging technology to be able to deliver solutions, but really not seeing that for women who were in their 40s and 50s and 60s and beyond, especially at a time when you're thinking about transitioning from commercial insurance to Medicare, which is really interesting transition points. And we go think about, the payers. I won't name whom, but I had somebody who manages benefits for a lot of insurance companies say, well, and then women retire and basically we don't care about them anymore. So there is this specific set of issues around, both at a societal level in terms of medicine and in the workforce. We think about women aging beyond their reproductive window, fading into irrelevance, no longer mattering. And I think that is what really motivated us. And the personal part of it is that I'm one of 3 daughters of 2 physicians. In particular, my father's a OBGYN turned urogynecologist, so really focused on vaginal and bladder issues. And that was a very normal topic around the dinner table growing up, and then realizing just how rare that is. Especially when we think about women who are aging, who really are, at the apex of their careers, of their lives. They have another potentially 50 years ahead of them as women are outliving men. And yet we have so little that is built for them and around them. And as we've discussed, centers them. So in terms of, why we thought that this was such an opportunity, and the traditional system, and I think the word used is deferential, which is an interesting word. There's this confluence of issues where menopause and its attendant conditions have been stymied by a lack of research, lack of data. And if you can't see it and measure it, you're unlikely to be focusing on it and building new innovation and initiatives around it. And the fact that there is a lot of confusion around hormone replacement therapy, which is one of the gold standard treatments in the space. And so you have women who have said to us, pre-COVID, when we were hosting community events in members' homes, so Electra members would bring their friends, and we would bring a medical expert, often an OBGYN, or somebody who understands hormonal health. And there would be this aha moment of, no one ever told me about this. And why is that? And even if I loved my OBGYN, I feel so sort of dismissed and out in the cold, and I don't know where to turn and I don't know where to look. And I think that is a theme that we hear time and again across all of our different domains on this panel. But we felt that it was, especially significant for women entering this menopause transition. And so the combination of education that is medically based, evidence-based, community to help women feel that they are not alone. There are 34 symptoms of menopause that vary across 10 years. So that transition is, really shared by half the population, yet so infrequently discussed, as well as access to care, because symptoms can be managed with evidence-based treatments. And there is a lot that women can do. And so equipping them with those tools requires an integrative approach. And that's, the gap that Electra has filled and continues to fill.
And isn't that a perfect microcosm of the female experience in healthcare, where it's, I don't really know what to do for myself, and yet you're QBing 80% of the healthcare spend in the system, making sure your family gets all of this care. Now, we discussed this actually last week, Carolyn, and I kind of want to continue on this topic for all of you. Because women are the care navigator of the home, the CMO of the home, is there an opportunity to then expand your solutions well beyond the women's health sphere? Will I see pediatrics at ULA, or will I see, broader family care at Health in Her Hue? So be, health in everyone's hue. Will TIA become TIO? Adrienne, let's kick it off with you. Oh, no, Ashley.
No, Kaveh, I love it. Adrienne, please go ahead.
I feel like right now, you never say never, but we're hyper focused on pregnancy care. I just think there's a lot to get right there. I mean, it's 9 months of primary care, an inpatient episode thrown in the middle. brings together emotional, physical, social, mental. I mean, like so many things come together to get that right. It's where we spend over $100 billion each year in just like medical cost. It's the first usually like concentrated interaction a woman has with the healthcare system. And so it just feels like a huge opportunity to like support her, get it right, set her on like a journey of success after, if we're able to make it a moment where she looks back on it and is like, wow, I felt really like supported. I felt like I had the tools and the resources and things around me. So for now, we're just, it feels like, you know, it's the case, I think so many things in healthcare are definitely women's health. And it goes back to maybe like some of our comments about, you know, investors feeling like, you know, they can only make one investment in this space. Like each of these are like multi-billion dollar opportunities. You don't need to do more than like one part of it to build a really massive business.
I'll echo what Adrienne shared, and the challenge of delivering really excellent care and focus. I think as a platform that really, you know, positions ourselves as the anti-point solution, really anything can fall within our scope. It's constantly a struggle of breadth versus depth, not only in women's care, but in family care, as you point out. And so is it possible that TIA might expand into broader services that aren't for women? It absolutely makes sense. We get requests from this all the time for things like pediatrics. I joke dental care is a frequent request that are also multi-billion dollar companies or multiple players in the space and so forth. And I think the real question is, what should we do ourselves, and where should we partner, and where do we navigate? And I think going back to what you described earlier, Stephanie, even today, we're doing an aspect of family care in terms of from navigation perspective. You know, when I spend my time these days, often with, you know, CEOs or CFOs of hospital systems, we often describe the significance of specifically the pregnancy journey, not just in the eyes of women, but in the eyes of the family. And the opportunity for that singular episode to be the best or the worst day in that family's life. And you can be sure that if you have an amazing experience across that pregnancy journey, both outpatient and inpatient, that family, not just that woman, but her partner, her children are going to remember that. And if her partner needs knee surgery in 10 years, she's more likely to go get that knee surgery where she delivered a baby if she had a great experience. But if she had a bad experience, you can be sure she's going to the hospital down the street, or he's going to the hospital down the street. And so this is, I think, the ways in which that quarterback relationship, that trust that we keep talking about is so critical and can unlock access to new opportunities. Whether we do those services ourselves or partner with others who provide those services and route that care, I think is always the question. And I think where TIA is really focused today.
I hear that. It's $3 trillion, right? It's a large system. We're trying to go and capture all of it. Now, when I was looking through the Q&A that we were getting well ahead of this event, there was one question that came to the forefront, must have been 15 or 20 times. And that was from the female entrepreneurs that are in the audience. What advice would you give a young woman looking to enter health tech? And if you could do it over again, is there one thing you would tell your younger self? Janine, do you want to kick us off?
First of all, we welcome any and all entrepreneurs interested in the space. I think, you know, Adrienne said it, but it's a massive space. There are many multi-billion dollar opportunities here. And so I love to see that energy and enthusiasm. And by the way, you know, the people who have helped us most along the way have often been other female entrepreneurs. I know Adrienne has fielded many of my, you know, late night or last minute text messages, and the support among this community is really special and something I'm grateful for. I think advice, you know, I think it always comes back to whether you're entrepreneurship or anything else, the people that you surround yourself with. So I feel deeply fortunate to get to build alongside my co-founder, Alessandra. And we just came back from an offsite last week with our small but mighty team. And it just leaves me so, you know, refreshed and energized to be surrounded by people who are deeply mission driven. And I'm excited to build with day in, day out, you know, in spite of a pandemic and all of the attendant challenges that throws in your way. So I would think about, you know, who are the folks that you can really work with early on, especially who can be alongside you in the journey of building, because there are definitely challenges and it can be tough.
Adrienne, I saw you chuckle when I said advice for your younger self.
Well,
Talk to me about this.
I was chuckling because I had mentioned like the pre-panel to these guys that I went out to raise capital during COVID. So definitely I don't recommend that for anyone. Hopefully that, we won't have another huge pandemic that is like
Number one piece of advice, no fundraising during global pandemics.
I do think what I take the most out of going through that fundraise process was just, it sounds obvious, but I think I didn't do a great job of it at the time, which is run it like a sales process. There are going to be a ton of folks out there who are not going to be your cup of tea, are not going to want to be in women's health. There are going to be a number of reasons why they're never going to write the check. And don't sweat it. Don't spend your time worrying about those folks. Go after the people who are lead qualified. Go after the people who look like they're gonna write the checks. Go after smaller funds where there are fewer people who are you're gonna have to get to yes to write it. So just be much more strategic and thoughtful about the people you take the conversations with. Don't feel like you have to take every conversation or every person that's offering you someone to chat with. Be really rigorous about who you think is a great fit for you, who you want around the table, because building businesses are hard. You want people who are in your corner. So I think just really owning the fundraising process and really, setting yourself up for success and being just really, thoughtful about it. It's something I would have definitely done different and did the second time around.
No, I'm seeing some nodding from Ashley over here. I know you are approaching your seed round. You've done your pre-seed last year. Talk to us about this as you are getting up to speed and everything.
I was amening to everything Adrienne just said about not taking everyone's calls or emails and really being strategic about knowing what stage funds actually invest in, so that you're spending time talking to the people who are appropriate, at appropriate stage to fund your company. And then I guess, so that's the advice I would give my younger entrepreneurial self, is really be strategic about the fundraising process and who you talk to. And then just adding on to that, I think advice to budding female entrepreneurs is really surrounding yourself with incredibly brilliant people. So having advisors who are smarter than you, who understand the ecosystem, who have the relationships, that is something that has been incredibly helpful and beneficial to me. So I would encourage an entrepreneur to find those advisors that will really help set them up for success.
Good advice for that. Carolyn, last but not least, you're closing it out before we open up to Q&A. What is the advice for younger Carolyn?
I think figuring out the team, and particularly what I would describe the right balance of healthcare insiders and outsiders for your business. And I would describe myself as a healthcare outsider turned insider. I came from the consumer tech world. I have a brand background, didn't know anything about healthcare delivery or operations. And I think the kind of beauty of TIA and so much of consumer healthcare in particular is the way in which we blend both non-traditional healthcare playbooks with more traditional ones. And the truth is you need both. And so really asking yourself, where do I actually want to hire an amazing leader who doesn't know anything about healthcare? For us, that's things like consumer brand marketing, space design. Actually, I want our brand builders to really not come from the hospital systems as one example, and to think about different playbooks when it comes to protocols and clinical operations and quality control and payer contracts. I definitely want a healthcare insider who's been there and done it before, and there's a way to do that. And I think the beauty of models that really stand out are ones who can blend those two together. So figuring out what those roles are and matching them the right way for your product and business, I think is really key to save yourself a lot of mistakes.
That is excellent advice. And I hope for the folks in the audience that are debating that jump into health tech or, venturing into the women's health world, you feel a little bit more encouraged, and maybe you'll be on a panel with me one day. And Bunny will be writing about you. Now we have a ton of Q&A. I see the list. There's over 11 questions, so it's going to be hard to get to all of them. But Bunny, do you want to go in and start queuing folks up?
Yeah, I feel like we could go on for hours on this panel, but we did want to get some Q&A. So first up, I am going to play favorites and ask Dr. Ho to ask the first question.
Hello, everyone. Hi, this is Ing Ho. I'm a co-founder of New York City Health Business Leaders. I want to congratulate all of the women on this panel. You guys are amazing. You women are amazing entrepreneurs, and really congratulations for how far you've come. My question has a lot to do with thinking beyond capital. And as your companies become more prominent and you collectively actually broaden this whole framing of women's health, how can investors be more helpful to your goals in addition to providing capital? I mean, we often focus on the capital part, but investors can also bring much more. Love it to hear a little bit more about what you're thinking.
I can jump in here as a start. So I'm really lucky to have what I would describe as almost like an interdisciplinary cap table of investors who come from more the consumer tech side, some more traditional healthcare, and most recently on the sort of brand and brick and mortar retail side. And Tia's business has to fuse together all of those things. And so I think what I've tried to do, and always like our investors do beyond once they write the check, is saying how can we leverage their superpower, their strength, to help unlock various sort of aspects of growth in our business, cultivate those relationships, or solve those specific problems. So for certain investors, has been about building relationships on the BD side with payers and leading health systems across the country. And I have my go-to investor who can call up the CEO of any hospital system in the country and help me get a meeting type of thing. And then for others, it's really about how do I figure out real estate strategy at scale and really leveraging those types of relationships or expertise. So I think those are the things that I have found to be really beneficial. And then the other thing is really just also remembering that your investors are investors, but not running the business, and they will have a perspective, but aren't in the day to day. And I think that trust of your founders who you given money to make those decisions day in and day out, and the context of a lot of uncertainty and changing world dynamic is also a gift that I think is really important to help empower founders to make those decisions, weave in all of those different sort of expertise and perspective across an investor set to ultimately do what's right for the business in the context of the market.
Does anybody else want to jump in?
I'm going to build a little bit on what Carolyn said, which is I think when you're thinking about the investors going around the table or where you want their opinion and advice, there are lots of things with your company that you're innovating on and trying to do differently and trying to push the boundary on. And there are lots of things where they're well-established playbooks that people have been doing this for years and are doing it better. And you want to have people with those expertise around the table. So, building maybe our data infrastructure side of things, right? Yes, it's probably not the key to how we're innovating, but having a really awesome technical advisor who comes for that deep experience to help your tech team and give them advice. Great place to bring someone around the table. Or maybe your CX function, right? People have been running call centers for years. There are definitely ways in which you want to make them more consumer centric, absolutely, but they're also just playbooks and SLAs and benchmarks and things to bring to the table. So I think understanding across your functional areas, how as businesses scale, there's just well-established ways to do it that you shouldn't have to spend your time and your energy iterating and innovating on when it's not the core to what you're differentiating on in the market.
Great. Next up is Sasha Kellerman.
Hi, everyone. I'm Sasha Kellerman. I am head of Women's Healthcare Investment Banking at SVB Leerink. Really excited to hear from all of you today. Stephanie, good to see you again. We touched a little bit about the D to C to B pathway to really scale and reach profitability towards a pay angle, but I'm curious to hear if you can talk through a little bit more of the opportunity you see from selling to employers. So on one hand, there's of course fatigue of employers, having their benefit programs, trying to figure out which offerings to provide for employees. On the other hand, COVID has really exacerbated the burden placed on women, and there's heightened increase now and opportunity to provide more comprehensive benefits to employers, especially, Jeannie, as you mentioned, once you're hitting menopause phase, you're really at the pinnacle of your career. So curious if you can touch on that.
I'm happy to respond in the first instance. Thanks for the question, Sasha. We're actually seeing a lot of interest from employers more recently. And I think there are a few different reasons. One is just this confluence of factors affecting women in the workplace and the Great Resignation, or whatever we want to call it. But the idea that there is a lot more that we can do to support and retain women in the workforce at every level, whether we're talking about, C-suite executives or the folks that are on the front lines. And there, is increasingly interest from brands that consider themselves progressive and forward-leaning, and perhaps were early to adopt benefits around fertility or maternity or postnatal or parenting, and then sort of look at their stack and scratch their heads and think like, well, what do we do next? And so we're fortunate to be chatting with some of those organizations. But the other thing I would say is that the US really falls behind some of its international peers in this respect. So if you look to the UK, where there's been a lot more research, and organizations like Santander Bank or Vodafone already putting into place policies to help support women navigating perimenopause, menopause, and beyond. There's legislation in Parliament around it. So it's sort of a shift at a societal, cultural, and also regulatory level that we have yet to see in the US, but I think it will come from individual employers wanting to do right by their workforce and wanting to look like they are ahead of some of these trends, rather than it coming from the regulatory arm or, HHS or anything like that.
I can jump in really quickly to address that question as well. We've been seeing some interest from employers and EAPs that want to center health equity. I think COVID-19 has really illuminated the importance of centering equity and finding equitable solutions to meet employees' needs. And then employers are also trying to attract and retain diverse employees. And so offering solutions that are tailored to specific demographics is definitely, I think, something that's becoming, the employers are becoming more open to and are seeking out solutions that address that.
Okay, well, we're almost at time. So our last question is going to come from Laxmi, but I will say this: we will forward all the questions to the panelists, and if there's an opportunity, we'll try, if there's interest, then they'll get back to you. So Laxmi, why don't you end us off with your question?
Sure, thank you. So hello, everybody. I'm Lakshmi Arthe. I'm the founder of Data Clarity, a data analytics company. I'm really interested in bringing my data storytelling skills to help women's health companies like yours succeed. And it's been a privilege listening to and learning from all of you. So thank you for taking the time. My question is related to the marketing of D2C women's health companies. So there's been an article in the New York Times and a few other publications recently where women's health products, the ads for them have been banned by Facebook, by Instagram, and other social media platforms. And this seems more like just another example of a lack of awareness and some level of bias, perhaps. So I was wondering if any of you have run into this and found any ways to tackle it or get around it?
I can start. I guess the short answer is no, I don't have the solution, but I think what you are highlighting here is really important and just indicative of so many of the barriers that women's healthcare companies face. We face versions of this, sort of our ads being taken down, our apps being denied in the App Store due to picture screenshots, leases being denied by landlords. It goes on and on and on about regular ways of doing business things that don't affect men's companies that sell Viagra, that affect women. And so this happens all day. I think there is a strategy here that's more around a collective effort and trying to shift the policies around what is considered health information versus explicit content at some of the biggest companies. And I think we can do that by lots of female founders in the space, like this group here, working together to try and change those norms. But there is absolutely a double standard here. And I think the ads is just the tip of the iceberg. And so I think it's important for all those working in the space, whether you work in healthcare or not, to really deeply ask yourself, in what ways are there barriers that are preventing needed innovation from happening? And it's not just capital, it's all the things that go into running a business day in, day out that are that much harder for healthcare companies focused on women.
Anybody else want to jump in on this one? Okay. Well, thank you all. This has really been a phenomenal discussion. As somebody who's a bit older than all of you, it's great to see what's finally happening with women's health being expanded to all of a woman's life. And so first, thank you, Stephanie Davis, and for being a phenomenal moderator and partner. And thanks for all the women, CEOs and co-founders, Adrienne, Ashley, Janine, and Carolyn, for doing what you're doing and for doing it so well. So thank you. And hopefully we'll see you guys online next week when we talk about healthcare investment trends. We already know one of them, and that's women's health.